Joseph Foudy joined NYU Stern School of Business in 2006 and is a clinical associate professor of economics. Professor Foudy has extensive teaching experience working on Stern's core courses on international economics and global business, as well as electives covering Asian economics and management, economic thought, and globalization. He's interviewed regularly on business, economic, and international issues and has appeared on CNN, Fox, PBS, and NPR, as well as many international and New York City television outlets. He has also been quoted in the New York Times, Wall Street Journal, Washington Post, and other international and domestic newspapers and magazines. His research interests focus on the impact of globalization on national systems, the political economy of financial and accounting regulation, and comparative corporate governance. He received his PhD in political science from Cornell University in 2004. Professor Foudy, thank you for joining us today.
Thank you.
So we like to kind of begin these interviews by asking the professors just to tell us a little bit about themselves, their history, and why they initially became interested in economics or finance or something else, if that was the case.
Yeah. In college, I was more interested in policy matters. I was interested in looking at issues that were focused on governmental debates of the day, healthcare, international financial policy, things like this. Over time, I became more academic in my interests. I thought pursuing a PhD would be interesting. I thought I might want to teach, but wasn't really quite sure. And then over time, the interest really deepened, and then I found a sort of focus or niche in trying to get a sense of how countries vary, how economies are different by country. And that's sort of the focus on a lot of my thinking every time I teach a class, trying to understand what it's like doing business in different countries and in a global world, what the impact for students is going to be.
So why is the deficit important to our generation, and is it important to all Americans? Is it important to college-age students?
Well, it's important to all Americans, but for college-age students, the deficit stands as a critical issue for future. For starters, it's your generation that's going to be paying off much of this debt, but more generally, it's your generation that's going to see benefits being squeezed for the first time. We've been able to maintain basically very generous benefits for retirees, not just Social Security, but Medicare and Medicaid. And as those costs continue to grow above inflation, there's going to be more and more pressure to keep it in check. And unfortunately, it's going to be your generation that faces either that tax bill or reduced benefits as you get older as a consequence.
So, in your experience, either in the world or in the classroom, have you come across any specific institutions or events that you think have most impacted our situation and the reason, and are they the reason that we're in this mess in the first place? Can you locate any one specific idea or group that may have caused the growth of the debt at such an enormous rate?
I really think this is a death of 1,000 cuts. Something this big doesn't have just one explanation. One factor is just the political culture. A generation of Republicans who are against any form of tax increases, combined with an acquiescence to spending increases that Democrats have pushed. Another key factor that not just for today, but for the long-term debt that we worry about over the next 20 or 20 years is growing healthcare costs. We know we pay more for healthcare than almost any other country. We know there's both economic reasons for why that's the case. We know there's problems in the quality of healthcare. We know costs are out of control. It's just a tremendous multidimensional challenge that all of our generations are going to be facing. Then lastly, in the short run, what you're seeing has just been caused by this horrendous recession since 2008. The recession will dissipate, and the political dynamic in Washington may actually change. I'm skeptical, but it could. But whatever happens, we're faced with rising healthcare costs and a struggle for how to pay for them.
In an article kind of off of your point recently in the New York Times, journalist was noted as saying that healthcare spending as a percentage of GDP in the U.S. is supposed to double by 2035 from 20% to 40%. How do you see healthcare costs and healthcare implementation strategies kind of changing over the course of time if the issues today aren't addressed?
The healthcare costs are just going to grow and grow and grow until pretty soon, many Americans are basically spending half of their income on healthcare, either through taxes or directly. And healthcare costs are going up for everyone, not just for the government, but for the private sector. I mean, health insurance companies are spending more money on health insurance for their own workers, so nobody really has a solution. So either we spend more and more money on this, or we're going to come to a situation where we're just going to enact some form of rationing. Workers are going to have to pay more, and then we're going to face cases where we're just simply going to say there's some level of health care we're not going past. And unless we can find some model of cost containment, we really have no choice. And what's challenging is nobody's really found a model to keep costs in line. They're just growing above inflation every year. A good year is 4 or 5% growth in healthcare. A bad year, 8 or 9.
One of the things that you mentioned were government and private healthcare availabilities, and under this government umbrella, there's the Medicare and Medicaid program. Medicare catering, if I'm correct me if I'm wrong, to the sort of senior population, while Medicaid offers healthcare services to lower income families. Do you see any specific instances where these plans might change, or do you see one changing before or after the other?
Well, Medicaid is something that is growing, particularly as we see more people with healthcare needs, people on disability, areas like that. And it's something as well where the state plays a really large role, so it's just putting a big burden that way. But both of these plans are just being burdened by an aging population and healthcare costs that are growing irrespective of the age group. In other words, senior citizens today, more people are getting older, but it's not a huge demographic change. But even if we held the same number of senior citizens constant, we're still facing growth above inflation of 2 to 3% a year.
Some of the strategies that government has recently enacted or attempted to enact, among them, on the top of all of our minds, is the Affordable Care Act, kind of colloquially named Obamacare. Given the current sort of budget constraints and fiscal environment in the U.S., what is your sort of opinion, or what sort of stance do you take on the government's role in providing health care at a time where funds are not low but strained?
I view Obamacare as something of a sideshow to our problems. This is really something that's designed to help typically younger people without health care. In that sense, the cost is not as great as it's advertised, but neither are the benefits. Our real challenge is health care costs for people over 65. 80-90% of health care costs sometimes are in the last 2 years of life, and it's really bringing that under control. The other thing that's important to remember, whether it's public, whether it's private, as long as you have a system of insurance where the insurance is going to pick up all of the costs and you pick up relatively few, whether it's a government program or private health insurance, there's no system in place to sort of keep costs in check. You just go to the doctor, they send a check, and that's it. And what's important to think about is we probably spend twice as much on healthcare per person as we did, 20 years ago, maybe even less than that, maybe 15. Do we get twice the benefits? Are we living twice as long? Obviously not. And so we're paying more and more, but it's not clear to me we're getting any real tangible gains. How many blockbuster drugs have been developed in the last 5 or 10 or even 20 years?
Right. Clearly healthcare not a good issue, or not a good topic or segment of government spending to toy around with, and certainly something that might be affected by the deficit and the growing debt. Professor Foudy, thank you for joining us. We really appreciate it.
My pleasure.